Happy Wednesday, Facebook family and friends. It is Dr. Abby Connell at Carolina Hearing Services in Charleston, South Carolina. Hoping everyone's having a great week so far. Today we're going to talk about some general hearing loss topics. Primarily, do both ears typically lose hearing at the same time and the same rate? If so, why? If not, why? Also, what are the types of hearing loss? How do you know if you need to go see an actual MD about your hearing loss versus just going in to see a doctor of audiology or a hearing aid dispenser? And what are some of the other factors in the environment? Is hearing loss just age related, or can there be some other environmental factors that can create hearing loss, or genetic issues that can create hearing loss, and whether or not all hearing loss is medically treatable or not. So lots of fun things to talk about today. And I'll try not to make you too seasick because I am going to be moving back and forth to show you some great examples. First question that I was asked that brought up this topic for this week was, do both ears typically lose their hearing at the same rate? And the basic answer is yes, most of the time. Typical hearing loss that's due to the aging process is usually going to see a symmetric loss where both ears are going to be losing their hearing at the same rate. However, there are some hearing losses that are due to acoustic trauma, noise trauma, people who are in the military or police officers, or people who just do a lot of hunting or shooting and they're not using hearing protection. They can get more acoustic trauma in one ear versus the other. Typically, when we do see hearing loss due to age, it's also known as presbycusis. And so with presbycusis, we would see a pretty typically sloping hearing loss that would be what's called sensorineural in nature. Sensorineural is one of the three types of hearing loss. That means that the entire hearing loss is secondary to damage in the inner ears. Then there's conductive hearing loss. Conductive hearing loss means that the inner ears are totally fine and healthy, but the middle ear is the problem. It could be due to a lot of fluid or ear infections that are clogging the middle ear space. It could also be from the middle ear bones not moving properly. And then there's a mixed hearing loss, which is a combination of the two. So I'm going to show you a few different audiograms, which is the term that we use to graph your hearing, or it's not the term, it's what we graph out the hearing on. It's called an audiogram. So I'm going to show you a general audiogram first, and then we'll actually look into some audiograms that I made up to show you what exactly the differences are between sensorineural hearing loss, conductive hearing loss, and mixed hearing loss. First, I'm going to show you something that is a really handy tool. So this is what's called the audiogram of familiar sounds. And I want to make sure that that's nice and clear. So when we graph out your hearing, we graph hearing across the board from left to right, from low bass pitch over to high squeaky pitches. And then down the side, we go from extremely soft sounds at the top down to painfully loud sounds at the bottom. This little speech banana in here shows you where all of the speech sounds in our language occur as a function of pitch or frequency and as a function of loudness. So as a general rule, a few weeks ago, we talked about things that could damage your hearing from a noise perspective. So if you're out mowing the lawn or riding on your motorcycle or shooting guns and you're not wearing hearing protection, you are setting yourself up for the likelihood of hearing loss that would be completely damaging to the inner ears. As I just mentioned before, inner ear hearing loss is called sensorineural. So I'm going to flip my screen so that I can show you an example of what a typical sensorineural hearing loss looks like. I'm going to let everything come into focus here. So the red circles indicate right ear responses. Right is typically always, not typically, red is what we mark the right ear and blue is what we mark the left ear. Now going across the board, sorry for my movement here. So we're going from low pitch down to high pitch. Normal hearing is from 0 to 20. So across the board in this particular example of hearing loss, the right ear is still in the normal range in that low pitch, and we drop off from a more mild down to a more moderately severe hearing loss. This is pretty typical of a person who is just has age-related hearing loss. Now you'll notice on this example that we have some red circles and then we have some little red hash marks or little carets. When the circles and the carets match or are within 10 to 15 decibels of each other, that is indicative of a sensorineural hearing loss. So when you're getting your hearing tested and you're listening first to the beeps with headphones, either headphones that go over your ears or in your ears like earplugs, that is what the circles and the X's for the left ear are telling us. That tells us how much hearing loss there is and at what frequencies or pitches the hearing loss is present. Then we'll typically put a little headband on the person's head, and there's a little box that goes behind one ear. We then test the beeps again, and that's where we can plot these little hash marks or carets. That is how we can tell what type of hearing loss you have. And as I mentioned earlier, the types of hearing loss would be sensorineural, conductive, or mixed. This is an example of sensorineural because our little hash marks or little carets are matching or within 15 decibels of the circles. Okay. Now I'm going to pull up an example of a conductive hearing loss. If it's going to let me. Oh, now it's not going to let me. Okay, so let's do this. So a conductive hearing loss would be indicated by the hash marks being far away from those circles. So in this example, our circles are down here and all of our little hash marks are up in the normal range. So that would tell me that for this particular individual, their inner ear hears totally normal, but for some reason, when the sound is going through the headphones, it's being blocked and showing me a hearing loss. So when you have this large separation, clinically defined as 15 decibels or more between the circles and the little hash marks, that's indicative of a conductive hearing loss. And in that particular example, I would be making a referral to an ear, nose, and throat physician or an MD that specializes in ear disorders. Typically, a general ENT or an allergy ENT would not be specially trained in being able to deal with ears specifically. So there are some ENTs that are specifically trained in ears only, and they are known as neuro-otologists or otologists. But typically a neuro-otologist would be the type of ENT physician that would be able to determine whether this hearing loss is just due to infected fluid, non-infected fluid, or due to the middle ear bones not moving the way that they're supposed to. That would be how you would define a conductive hearing loss. And then there would be what is known as a mixed hearing loss. So, since my software is not letting me change easily, let's just make a quick mixed hearing loss. So I mentioned just a moment ago that normal hearing's from 0 to 20. So in this case, we have some circles that are in the normal and then not in the normal. And now we have those little brackets. Some of those brackets are in the normal range, but some of them are not. This means that we have a combination. This person's hearing loss is not just in the inner ear, but it's also in the middle ear. Sometimes there are surgical options that you can consult with an ENT physician to determine if surgery might be able to correct part of that hearing loss. But with mixed hearing losses, you will typically still be left with some type of hearing loss because the inner ear is also affected. All right, so we're covering kind of a lot of technical data today, but this is one of those things where you don't always know what causes your hearing loss. If you remember back to, I think it was last week, we talked about earwax. Earwax could show a conductive hearing loss, but that's why the person that's testing your hearing, whether it's a doctor of audiology or a hearing aid dispenser or hearing instrument specialist, should always be looking in your ears first. You never put anything into somebody's ears or over their ears to test their hearing until you know that that ear canal is clear. Or you could get a hearing loss that's not actually a hearing loss, could just be because of a wax plug. So when you're getting your hearing tested, the main points to know is that they should always look in your ears first to make sure that the ears are clear. Second, you're going to be tested for air conduction, which you're either going to have headphones over the ears or in your ears like earplugs. You're going to be listening for some beeps and either raising your hand or pressing a little button when you hear them. Those beeps and the headphones are telling us how much hearing loss there is and at what frequencies or pitches. And then the next step in that comprehensive hearing exam is you're going to have a little bone conductor or a headband that has a little box that goes behind the ear. That little box bypasses the middle ear and tells us exactly what's going on in the inner ear. So that is how we will know what type of hearing loss you have. When that hearing loss is 100% in the inner ears, it's known as sensorineural hearing loss. When that hearing loss is 100% in the middle ears, due typically to fluid, infected fluid, or any kind of middle ear ossicle or the bones in the middle ears being displaced, that would be a conductive hearing loss. And when you have a combination of the two, that would be known as mixed hearing loss. So you always want to make sure that you're having a comprehensive hearing exam so that you are aware of exactly the amount of hearing loss and the type of hearing loss. And then the last part of the major hearing evaluation is going to be a speech understanding or a word understanding test. And this helps us to know not just what's going on in the middle ear and inner ear system, but how the brain puts it all together. Because you have to be able to get all of that information up to the language center of the brain for sound to have meaning. So you will also then be asked to be repeating back some words. Recorded speech is always the best because if I have a cold one day, I don't want my voice quality to change your speech scores. So using a modulated speech signal is the best way to get an accurate exam. And you always want to make sure that you are getting your hearing tested annually if you have hearing loss, because your hearing can change. Not all hearing losses stay the same. For some people, they'll continue to decline as you age, and for other people, they'll stay exactly the same forever. But you want to make sure that you're always having your hearing aids tuned and fine-tuned to the most appropriate setting so you're always hearing optimally. Hearing screenings are almost always free of charge. Comprehensive hearing exams are not always free of charge, but most insurance companies do cover a comprehensive hearing exam. Here at Carolina Hearing Services, all of our initial hearing screenings and hearing aid evaluations are typically free of charge. And so, when you do see free hearing screenings, it's really important for your health. There's no reason not to go get a baseline hearing screening, whether or not you do suspect that you have hearing loss. If there's a huge difference between the ears and we can't explain why there's a huge difference between the ears, that's also worthy of a medical referral. There are some things called acoustic neuromas, which is a fancy term for a benign tumor that can grow on the auditory nerve. They're typically slow growing and benign in nature. But when you have that growing on one hearing nerve, typically we will see that one ear may still be in the normal range and the other ear may be showing signs of a hearing loss. It's important to be able to get radiology studies done, typically a CT scan or an MRI, so that the radiologist can look at whether or not there is a lesion on the hearing nerve that is creating that asymmetry. Sometimes that asymmetry is due to an acoustic trauma, such as if you're out hunting or you do a lot of shooting without hearing protection. Most of the time, if you're a right-handed shooter, the left ear typically takes on more of an acoustic trauma and vice versa. So there are times where there can be an asymmetry where there's not any tumors growing on the auditory nerve, but we can pinpoint it back to a specific acoustic trauma. Playing with fireworks, some people have reported to me that they have had explosive or a firework that explodes near one ear and they're left with hearing loss and ringing of the ears on one side. So these are all factors that can contribute to whether or not your hearing loss is the same in both ears or if you may have an asymmetry. Once again, as always, you should always get your baseline hearing screening. 90% of the time, at most places you're going to go to, it's going to be free. So come see me at Carolina Hearing Services for your free hearing screening so that we can get your baseline hearing test. If you don't live in the Charleston area, then you can always reach out to your primary care physician or look up local doctors of audiology, and I can also always help. So feel free to instant message me, private message me, or send us a message through our Facebook app or Facebook page, Carolina Hearing Services. As always, I'm Dr. Abby Connell, and I will see you next Wednesday for the live topic of the week. Give me a call at 843-556-4327 or give us a shout out on Facebook. We love to get all your questions. Have a great week, everybody.